Hello everyone and welcome to this Australasian College of Road Safety webinar on today, the day of the launch of the Global Plan for the Second Decade of Action for Road Safety 2021 to 2030. I'm Ingrid Johnston and I'm the CEO of the College of Road Safety, and it's my great pleasure to welcome you all here today. I'd like to start by acknowledging the traditional custodians of the lands on which we're all meeting, wherever you are in the world. And I know that we have people joining us from all sorts of countries around the world. I am in Canberra on Ngunnawal Ngambri country, and I pay my respects to elders past, present and emerging. So a bit of an overview of what this webinar will have. I'll start by just giving a quick outline of what is in the plan. Then we will hear from two of our co-conveners of our international outreach chapter, Ali Zayerzadeh and Masria Mustafa, to think about what it means. And then we'll have a panel discussion, and hopefully by then you will have put lots of questions into the Q&A, and we'll be joined by the college president, Martin Small, and also Laurie Moran, who has done many years of work with the UN Road Safety Collaboration. So where did this all come from? In September 2020, the UN General Assembly adopted a resolution on improving global road safety, proclaiming a second decade of action for road safety, with a target of preventing at least 50% of road traffic deaths and serious injuries by 2030. And we know that with the current rates, there is a lot of work to be done. Over 1.3 million deaths and 50 million serious injuries annually. Road trauma is the leading cause of death worldwide for children and young people. So the task ahead is big. The World Health Organization and UN regional commissions were tasked with preparing a plan of action. And it was meant to follow on from the first decade of action and take on board the lessons, the need for political will at the highest level, for good governance, for a focus on implementation and managing the evolving nature of mobility, and the importance of support to low and middle income countries. There is a high-level political forum on sustainable development scheduled for July next year, and road safety is firmly on the agenda. So it's worth just thinking about where road safety sits in the Sustainable Development Goals. Road safety appears in two different goals: health and well-being with the target, and also sustainable cities and communities with providing safe, accessible and sustainable transport systems for all. And that interconnectedness is really important when you think about the Sustainable Development Goals and the co-benefits that can be gained. Progress in one area leads to progress in the other goals. If we were to have safe, sustainable and accessible transport systems for all, there would be co-benefits for poverty, hunger, quality education, gender equality, access to clean water, access to decent work and economic growth, reducing inequalities, responsible consumption and production, and of course, climate action. So it's clear road safety action must be integrated with many different areas of policy agenda, and that's what the Global Plan is trying to do. So this is the overview of it. The plan is aimed at senior policymakers to underpin national and local plans and targets and put road safety as a key driver of sustainable development. The safe system approach is central in the Global Plan, and it takes the starting position that the target can be achieved through the implementation of the safe system approach, that it is possible to take immediate action towards implementing the safe system, irrespective of the context, and leveraging co-benefits of other SDG targets and ensuring responsibility by all actors will help to ensure that there are adequate resources to achieve the goal. The plan is separated into three different elements: what to do, how to do it, and who to do it, with recommended actions in each area. So the what to do, Multimodal transport. Public transport is, of course, key to SDG 11.2, and the plan talks about compact urban design, lowering speeds, discouraging private vehicle use, connectivity and incentives. On safe road infrastructure, talking about infrastructure being planned, designed, built and operated to enable multimodal mobility, the importance of star ratings targets and clear and measurable metrics. For safe vehicles, it talks about both active safety, designing to avoid crashes, and passive safety, designing to reduce risk when crashes occur. For safe road use, the plan talks about design and operation of the road transport system to take account of behaviour, and post-crash response, the importance of appropriate, integrated and coordinated care as soon as possible, strengthening the provision of and access to rehabilitation services embedded into acute care. How to do it? Financing is the primary responsibility of national governments, but the plan notes that in most countries, road safety is underfunded and needs to be embedded within transport decision-making, not considered an add-on, so that opportunities can be utilised to leverage existing investments in transport. It talks about the history of UN legal frameworks, and there are many of them. Speed management as a cross-cutting risk factor and continuing the push for 30km/h zones. Capacity development. The plan notes road safety professionals work in a variety of sectors: government, private sector, civil society, and research institutions. It notes that expertise is required for safe systems principles to be adopted and adapted in local conditions, and the need for accreditation of road safety as a field of study. It talks about the differential risk profiles by gender and the need to account for that, especially in vehicle occupant safety tests, and to increase the involvement of women generally in the transport sector and processes. It talks about various different technologies and the need for route planning by safety, not just for speed, and a focus on LMICs, which have 60% of the world's motor vehicles, but 90% of road deaths. The plan talks about the need for private corporations to adhere to road safety principles, regardless of the regulatory environment in which they're operating, and then opportunities which can be gained from regional and national collaboration to address common challenges. Who does it? The government have primary responsibility, but other actors are important and need to be incorporated. Road safety must be treated as a political priority and acknowledged as a valuable public good. It talks about developing a plan of action with targets and monitoring, public reporting for transparency and accountability, and the importance of measurable performance targets. The role of academic, civil society and youth expertise can help to fill gaps in implementing policy, generating evidence, advocating for change, the importance of including the voice of those with lived experience of road trauma, ensuring government accountability, and the importance of including youth, not just because of how they are affected in the statistics, but because the next generation have to deal with the long-term consequences of policy decisions which are made, especially in infrastructure. Private sector need to take responsibility for the consequences of their actions. The plan talks about things like cars being promoted based on the speeds that they can attain, policies and practices which promote driver fatigue, and the importance of accountability for corporations as well as governments. 60% of the top 100 economies in the world are corporations, and the plan talks about needing to think about accountability for corporations as well as governments equally. Private funders like international organisations, development banks and multilateral development agencies, filling gaps and stimulating government investment. but the importance also of finding a pathway to sustainable financing, and the role of the World Health Organization as the coordinating UN agency. Monitoring and evaluation are included in the plan. It talks about absolute and per capita indicators for deaths and serious injuries, and establishing 2021 baseline data so that we can measure progress. There's explicit recognition of the difficulties in serious injuries data, and that strengthening data collection systems for road safety must be prioritised. Countries are expected to assess performance routinely and use the findings to inform and improve planning and implementation. It talks about the need for quality data, trauma registries, standard data definitions, and linkages between sectors so that we can get the data from police, health, transport, all linked up to give us the complete picture. So that's a really quick overview of what is in the plan. It presents both opportunities and responsibilities. And now I'd like to welcome Ali to reflect on what it means. Ali.
Thank you so much, Ingrid. Hello, everyone. Hope you're doing well, and thank you for joining this session that is happening just hours before the global launch of the global plan for the second decade of action. I just want to raise some points, as you mentioned, that are very important. As you mentioned, the global plan. I want to start with what we learned from the last decade. As we are aware, the last decade, mainly for the LMICs, we were focusing on the what we should do for the road safety, as it has been mentioned in the global plan, but it's only one part of this new global plan. So during the last decade, we had different manuals and guides from the WHO and other organizations about what we should do or what should be done for the speed management, for increasing the helmet wearing rate, for motorcyclists and power two-wheelers, other things. And what we learned from the last decade is that we now need to more focus on how we need to know should be done, how we need to do that, these guides, and with different examples from LMICs, we learned that due to lack of capacity building, many countries have problem with how to do it. Okay, we need what to do, we have different plans, we have action plan, we have strategic plan, but mainly because of different problems we have as it had mentioned in the global plan. We have a section for the low and middle income countries, and we can see that it has been written that the diversity of context and geopolitical situation among low and middle income countries reinforces the importance of regional and national collaboration. So we see that in this new global plan, the approach is that we need more things, more information, more capacity building to work on the how to do section. And another important, as you mentioned, Ingrid, is the who should do it. And it's mainly about accountability, responsibility, and also learning to work together, team working. That is really important in different countries. And we know that what in high-income countries are being done or being implemented, the way they're improving road safety in the countries, and their method is not like a cookbook that we use in just as in low and middle income countries. We should adapt it to the situation that's running in these type of countries, and yeah, and the capacity building and the capacity review is an important two important topics that we need to think about in middle income and low and middle income countries. Another issue, the last point I want to raise, is the more looking at integrated approach. Before that, we were hearing from some countries that, okay, we have mobility plans that are rivals of the safety improvement plans. But now in this global plan and other UN resolution, recent one, we see that only we have one unique thing that is called safe mobility, and we should think about how to improve safe mobility, and we don't have rivals like before. So we should most focus on this kind of thinking approach for the coming decade of action to 2021 to 2030, to be able to reach the ambitious goal of reaching 50% of decrease. Thank you so much.
Thank you, Ali. And now I'd like to welcome Masria to reflect on what the plan means.
Okay, thank you very much. I would like to, reflect back on, we were once talking about a world free from COVID-19. What about a world free of high-risk roads? Should we need further elaboration on that? What kind of vaccine that we need to have? So basically, I think there are quite a number of question that we need to ask ourselves. For example, how safe are the world's roads? How safe are our country's roads? Where are we right now? What kind of implementation or strategies that we can somehow focus on? So maximizing travel on roads that are 3-star or better will save lives and reduce injuries. So basically, I think let me start by reviewing our passes on road safety locally, what we have in Malaysia. We had previously the road safety plan of Malaysia 2014 to 2020, which was launched at the end of 2013, and also aligned with the global plan. And we had previously implementation of this road safety plan through several pillars. For example, we've got road safety management, safer mobility and roads, safer vehicles, safer road users, as well as post-crash management. So far from the previous version of road safety plan that we have locally, we had successfully reduced the death index from 3.4 in the year 2010 to 1.97 in the year 2019. So basically, our local plan has set a target to halve the predicted number of road safety deaths by the year 2020 from 10,716 to 5,358. So we've got various initiatives as well as intervention measures, programs crafted to increase the awareness of and compliance with the laws and subsequently contribute to better safety levels of Malaysian roads. Among all, we've got motorcycle lane strategy, community-based program, UN rules for vehicle type approval, as well as road safety audit program. And our ministries of transport had cooperated and received supports from various government agencies, non-governmental organizations, higher education institutions, as well as private sectors and society at large, in order to make this implementation or program successfully implemented. And I think there should be some kind of like a way forward for it to be continued, because we are not talking about the vaccine for now, but we also would like to have, we would also need to talk about the vaccine for the future. So I think from me for the moment, that's all.
Thank you, Masria. I really like that idea of a vaccine for unsafe roads. Let's see how long it takes us to come up with one. So now I would like to welcome the College President Martin Small and also Laurie Moran to join us for a panel discussion. And please, everyone, put your questions into the Q&A function, and we will try our best to work our way through each of those questions. Laurie, maybe we'll start with you. Did you want to just give a reflection on your thoughts on the plan?
Yes, this plan is slightly different from the last plan, and the history of why that's the case is that we were disappointed. The collaboration was disappointed that there was no road safety goal in the Millennium Development Goals prior to the Sustainable Development Goals being developed. So the collaboration really worked hard to work with the people who are developing the Sustainable Development Goals, and thankfully succeeded. And there is a clear nexus between environmental issues and road safety, as you pointed out earlier, Ingrid. So it's going to be a challenge. I mean, we're a bit disappointed because in the last decade, although we made some progress, and I'm very pleased to hear about the progress in Malaysia, but we fell short of the mark. And so I think in this decade, we really have to inject some real energy into our work and try to build partnerships and build community demand really for road safety. So I'll leave it there for the moment.
Martin, what are your thoughts on what the plan means and what opportunities it presents for us?
Thanks, Ingrid, and thanks. Fantastic to have those opening thoughts from Ali and Masria, the co-chairs of the college's International Outreach chapter. Thank you very, very much, and thank you to all those people who have joined us here, and for some of that context from Laurie, which is actually really important. I'd like to just say a few things, and I think first of all, we know that the scale of the challenge is immense, and actually what we need is a massive scaling up of the response, and the plan deserves all of our support, and we need to provide that support from the perspective of a high-income country such as Australia and New Zealand, and from a low and middle-income country perspective. In countries such as Australia, it's really important that we actually deliver on those targets that have been set, because this is an important part of the whole improvement process. So nobody should ever think that it's less important here because of the scale of the importance elsewhere. What we do here in Australia and New Zealand really does matter. But I suppose I think that the plan leads one to think that we have a sort of there's a technical problem being addressed. And we know that actually what we're dealing with are leadership and investment problems. This is a primary issue that we have. As Masria and Ali have identified, we know a lot of the what. In fact, we know a fair bit of the how. I think there's actually, I would encourage consideration about governance and responsibility. I have the immense privilege to be invited into countries from time to time and to review their capacity to deliver on the safety goals of their country. And I actually think that there's a case for that at the global level. The WHO has done, I think, a very good job, and the road safety collaboration is a really important sort of signal to the community, about the global community as a whole, about the importance of this issue. But it's not nearly enough. And what I don't actually see is the governance systems that would be required in order to actually drive substantial change. When we look at major other public health issues that have been tackled and are on the improve, such as malaria or HIV/AIDS, that's come from an institutional response with masses of investment behind it. And we're not there. And we need to find a way to get there. And I think that this is the bigger problem that we have, and we need to keep in mind as to our capacity as a global road safety community to actually deliver on this plan. I think the other thing is just responsibility. I've spoken about this a little at our conference last month. I think that we really need to just take a little more time and effort on actually identifying who's actually responsible for what here, and actually being reasonably specific about it. So I think it's really important that the plan has some of those things spelt out, such as the private sector and some of the things which they can be doing and leading. We know in Australia, the private sector has left the government well behind in terms of its climate change response. How are we actually going to get that sort of dynamic going in road traffic safety? So I think this is a really important document. I think it deserves our support. I think we need to deliver wherever we are. It's a real sort of point, actually. We each need to take agents in our own area and deliver better safety in our area. And very interested to hear where the discussion goes.
Thanks, Martin. We have a question from David Williamson about COVID. It's going to be critical to get robust plans in place over the next couple of years if there's going to be any chance of meeting the goals. How is this planning going to be achieved when many countries are still focused on COVID recovery? So it's likely that road safety will not get the attention it needs. Who'd like to tackle that one?
This has always been the dilemma for us, because road safety traditionally hasn't been seen in the mainstream public health agenda. And so in the last decade, we recognized that tuberculosis and malaria were about on par with road safety. In fact, road trauma is rising in terms of the sheer numbers of deaths and morbidity. So it's going to be a challenge, but I think that we need to have a stronger voice to let people understand that it is a big problem, and COVID is a pandemic at the moment, but we've had a road trauma pandemic for many years, and so I think it's just a matter of this plan is going to help, and the fact that we're included in the Sustainable Development Goals, but there is a big challenge. I think part of it is so in public health, the health professionals haven't really been working in road safety from a prevention perspective very much, but we need to, and in transport we've really carried the ball, and it is going, we're going in the right direction. We are starting to learn the importance of collaboration more, but yes, that is a challenge for us.
I'd be very interested in any reflections that Masria and Ali have over, how you respond to, how you get things on the agenda. What I'd say from a historical perspective is there's always something. Now, it happens to be this really big thing, which is COVID-19, but there's always, when When have you, as a safety practitioner, turned up to a decision maker or a funder and they've said yes? When has that happened? No, it's hard work, and you get told no more often than yes. So yes, we have this confounder now, a big one. But it was the global financial crisis 10 years ago. 10 years before that, in New Zealand, it was the big fallout from the Asian crisis at the time. There's always, and in a national sense, there's always confounders. It just means we have to work a bit harder to run the agenda.
Ali and Masria, what are your thoughts?
Yeah, I can also add that it's, of course, we all know that COVID-19 had a big impact on all the global aspect, and we had different problems with that. But we should bear in mind that it's a temporary situation if we look from the road safety lens, and we had decrease in road traffic volume, and in not all the countries, but in many countries, it led to reducing the number of traffic fatalities and injuries. But we know we have lots of postponed events, postponed trips, and different things that we are just waiting for a proper time to do it. And we must be aware, and we must raise the issue and talk about it, that what will happen in coming months and next year, that we'll have probably big issues with the road safety. We know that even in our country, that there are increasingly we are observing the traffic volume, and maybe we would expect that I don't know, a high increase in the number of fatalities, crashes will happen. So we must be aware that how this temporary impact of COVID will have an effect on the raising the maybe crashes and fatalities in the next year or coming months.
Masria, we have a related question on how we can engage LMIC governments who might not see the need to prioritise road safety.
Basically, I think just from Malaysian experience, I think I can also reflect back to the previous question on the planning strategies, because currently I think a lot of government in the world, we are in the recovery stage. So we are no longer talking about COVID-19 as a pandemic, but now we are moving on into the endemic time. And all the sectors, all the industry need to move on. And in order to move on, transportation sector need to move. And from our experience in Malaysia, even though we had a lockdown since 18th of March 2020, but we've got another kind of like problem. In fact, the gig industry had been, kind of like increased in terms of the demand. So the P-hailing riders, for example, the motorcycle riders, the delivery workers were involved in an accident. So basically the number of accidents involving the motorcyclists, the riders who were also among the frontliners of our country became higher. So the government tried to, kind of plan strategies in order to rope in everyone, in order to, kind of come up with strategies to improve the situation. So when we are talking about having everyone or having the government that do not really see or prioritize these what we call it road safety. I think what we can do, we have to identify some barriers. What would be something, why that they did not even involve in this kind of situation? Why? Perhaps I am not saying that all government should some kind of focus on road safety and put it as a first priority, but somehow at least there should be some, agenda in the transportation plan for that particular country to focus on this. And somehow they have to, have a good leadership and try to have several programs, try to involve in several programs that also been implemented in the other part of the world. So it's not only about them, it's about, the whole world, and it's about the whole region. So I don't think that they can just be quiet on this and try to hide what kind of problems that we have in terms of road safety in their country. I hope I answer the question.
Solved it, I think. So as Laurie was mentioning, we need to, we haven't done very well at engaging the public health sector in this, but the plan talks about the importance of that and past even the health sector. When we're having trouble engaging governments around the world already on this issue, how do we extend it out then to engage the other sectors that we know we need to include in order to get that systemic action?
I just wanted to add a couple of other dimensions that we need to think about. Traditionally, in countries that are seeking to rapidly develop are getting loans from development banks for infrastructure, for road development. And the ambition is to increase mobility, and they're in a hurry to increase mobility. And we've seen it, there was particularly in places like Vietnam that build high-speed roads very quickly, and the death rate went skyrocketing. So the development banks are now seeking to find ways to leverage their loan, their money capacity to demand. The Asian Development Bank originally said, they won't fund any road project unless it's going to meet a 3-star standard. So those are the kinds of levers I think that we can use to get governments to pay more attention. The other one, I forgot what I was going to say. Well, I'll come back to it later.
I think that we're probably each coming from this from a slightly different angle. On the call, there's probably people in government, there's probably researchers, there's people like me and Laurie who have been consultants or are consultants and all this like. But we all bring the same commitment, because we don't turn up unless we are. And I think in terms of engaging governments or engaging other sectors, that we turn up is an important first thing. That actually there's a communication that actually this is not a good enough situation, that it's highly preventable. Those are important things to do. I think that there is a need. I'd suggest a couple of things. One is it's actually pretty straightforward. There's resources available now in a country that can be the global resources, where people have estimated using the IRAP type analysis or the like, what the total economic burden of crashes is in a country. It's actually sort of documented in a World Bank report from last year for each country. And you can sort of work things out for a city as well. We shouldn't resolve from that. These are extraordinary economic costs associated with road traffic crashes, and they need to be put in front of people. And they need to be put in front of ministers and other sectors. And we need to identify what they can do about it, given the situation that they're in there. One of the things that I think, so I won't talk much more about that, but one thing which is important is to have an idea of what would be a really useful, substantial thing that could be done. So that you're not actually trying to make things up on the spot. There's actually a few ideas, and we have a reasonably wide community now, and we can actually share things very quickly and easily. And there might be simple ways of people saying, well, actually, our problem is, the roads authority has been blocking activity in this for a long time. How would you go about it? We're not engaging with the public health side of things. How would you go about it? So I think that exchange is really important in order to come up with some concrete things which can be done. The other thing I'd say, and I'll stop here, is opportunity. If you know what the scale of the problem is, if you have an idea about some good things to do, opportunity is everything, and timing can be everything. That's when something dreadful, like extraordinarily bad happens, like a series of very bad bus crashes, like a series of very bad trucks crashes or child issues or something like that. It's actually having a few things organised so that actually the response can be really quite targeted. So yes, that is a very big problem, and it's actually part of this really big problem, and here's one or two things which you could do about it. So it's actually a bit of preparation and wait. It's almost, sometimes you have to keep quiet and pick your time.
Laurie.
I actually think that it would be very useful if someone did some research into what are the blockages, why the hesitancy to get involved. And one of the other thing I just remembered too, what I was going to say before, was that oftentimes people say, okay, I don't want to recognize this as a problem until I have a solution and I know what to do. And I know in Southeast Asia, particularly, there's a notion of face saving as well. And, we don't want to do anything in case we make a mistake. And that would be embarrassing. So the focus on capacity building will be very useful. But I think we need to understand in each individual jurisdiction, what are the things that are holding them back, and so that we can, find some, really relevant and effective solutions.
Masria.
I would like to add on what Martin had mentioned regarding the cost. Each road accident involves a huge cost to the industry, to the country, to the people. So including medical infrastructure repairs and then loss of productivity maybe. And somehow it's, I would say the biggest cost would be the loss of life that will definitely give a negative impact, negative social impact to the families of the victims. And with this, it reminded people that every life is precious, and everyone, all parties need to be responsible when they are on road, including the government. So whatever strategies that we come up with, we should somehow hand the governments more ownership of the road safety.
And we have a good question which ties into this from Duncan McRae. Governments will only bring about change when the voters call for change. So how can we support the community to be the drivers of change, to demand this? Does the community demand road safety, or do we still just accept people die, that's what happens?
I think the community needs support in that. Yes, ideally, the community is kicking up a stinker and the like, but it's sort of too easy to step back and say, look, the community isn't demanding it, and so I can't really sort of, put this forward to, my boss or the minister or, that sector or whatever. I have long been a firm believer of actually providing resourcing to community groups who are actually interested in engaging in the substantial issues of the day, like the safety of their local streets, like the movement of children to and from school, like any number of things. There are lots of really productive ways in which community interests can be engaged, and you can't rely, you can't rely entirely on that for getting the results that we know we need. But it's a critical part of the equation and needs to be supported.
Ali, how do you think we go about engaging both governments and communities, particularly in LMICs?
Is that for Ali?
For Ali?
It looks like he's not.
He's dropped
there
off. Okay.
Yeah.
Laurie, what were your thoughts?
Yeah. Well, one of the things I wanted to mention was that, the collaboration has of course, long-standing recognition of the problem of lack of motivation. And one of the things that we've done is we promoted the global alliance of NGOs, and NGOs play a really important role in Africa and Asia, at least, in really stimulating an interest and banging the door and saying something has to be done. So one of the things that we need to do is support NGOs in their work, so that they're promoting the right sorts of things. So capacity building again is important in that sector, but that's where the energy has traditionally come from in demanding road safety.
Masria, how do you think we shake things up so that we don't just make the same mistakes as the last decade? We've got a second decade because we didn't get there in the first decade. So how do we make sure that things are different now?
I think there are quite a number of things that we can do. For example, even in case of Malaysia, for example, and I think it's going to be the same with other LMIC or other countries in the world, to kind of like strengthening the institutional road safety management that we currently have. So we need to appoint one lead government agency to guide the national road policy action. This is somehow very, very important. And the other one, we should also to consider the effectiveness of road safety management at institutional level. That would require the consideration to look back into the results or the achievement that we had previously from our previous implementation of action that associated with something like legislation or coordination, promotion, monitoring, as well as evaluation, and not to forget research and development through knowledge sharing. So that would be something that we can somehow try to go into for this particular decade.
I completely agree. There's sometimes you talk about these sorts of things and people sort of see it as being a sort of a burden. as being a sort of a costly thing, as being a sort of a bureaucratic thing. Well, that's not, that's not the case. If you're expecting government to actually respond to this, this extraordinary crisis which is unfolding in low and middle income countries, you can't expect that to occur without them being able to ring up their secretary or whatever and say, what the heck is going on? I'd like that person, I'd like to see that person in 2 days' time. If those people aren't there, and if they don't have some of these sort of essential systems which Masria is talking about, things just won't happen. I agree. I think it will continue to be a really important thing. And I think actually there's a big lesson back to Australia and New Zealand and other high income countries here. I'm actually getting increasingly concerned about the lack of legislative priority for road traffic safety in countries such as Australia and New Zealand. And I think actually we need to make a bit of a stink about that here. Who is actually responsible in government for achieving these targets for this decade? And what are they actually doing about it? And who is actually accountable for it? So I think it comes right back into the circle. In low and middle income countries, it's possibly a bit more demanding, but it's a really important part of the equation over this next decade.
What role do you think that Australia and New Zealand have in the region? We should be showing leadership. But is that happening?
I think Laurie was going to say something.
Yeah, I think there's a lot of Aussies involved in consulting work and so on, and certainly we have not just that, but Austroads has made available their guides to low and middle income countries. So there's leadership and assistance, I suppose, is what we can do. We can't assume that we know, and Ali made the point earlier that if you try to just replicate what we do in Australia and New Zealand in other countries, it may not work. So we have to understand what the circumstances are for us to be effective in helping with that adaptation. So
I think, there are some things which are happening. For example, the Australian government support for the establishment of the International Outreach Chapter, which I know Laurie, was, working towards for years. Now, that's a really important sign. And the commitment over a number of years to supporting scholarships to our conference. Those are really important things and valuable things. But that does also get me back to this overriding problem, which is actually there's not enough investment into the problem. We need to actually just sort of, we need to be clear about that. Money going into generic infrastructure projects somewhere else is not going to deliver a road safety solution. It's not. It doesn't happen here in Australia, and it won't happen in low and middle income countries, because it becomes managed by road peoples whose imperatives are building infrastructure. They're not imperatives associated with delivering safer communities. So I think there's a big investment issue in terms of the aid and development budgets and the priorities given to the prevention of loss of health and life. I think that we do need to recognise that that there are things which are being done, but we've got an awful long way to scale up.
What do you think we might finish talk with each of, oh, Laurie, yep. You're on mute.
Yeah, many years ago, I wrote a paper linking road trauma and poverty. And it was poverty at the macro level and the micro level. And I think Masria mentioned earlier about the problem of if you lose the breadwinner in a road crash, then it sends that family into poverty potentially. And then if you're losing your workforce, and it's mostly young people that are getting killed disproportionately, it hurts the economy at a macro level. So I think that one of the things we can maybe be more clever about is making those links and making that known more broadly to people.
And that brings us back to the SDGs, and one of the differences in this decade of action being that it is linked into the SDGs with road safety appearing. What kind of a difference do you think that can make?
Well, that was a big decision. And Laurie identified the problem of road traffic injury not being recognised for the enormous problem that it was in the Millennium Development Goals. I entered that working space at a time where you could see it. You could see it. That for years, people had been told that other things were a priority. So having road traffic safety in there is incredibly important. Not sufficient in its own right. It's good for placing it within a sort of a much wider context as well. And as also has been mentioned before, we do need to make sure that we are constantly looking outwards and bringing more people and partners in. And I think the SDGs will be beneficial for that respect as well.
Laurie?
Yes, interestingly, in the UK, a lot of what I observed to be the basis of their success is that they treated roads as part of communities, and it was amenability. It was making sure that the village was, suitable for people who are walking to the shop or the whatever. And so I remember our first road safety plan in New South Wales in 1990. We had land use planning as a pillar in the plan, and the thing that we forgot to do is talk to the planners. But since observed in countries like the UK, there are those sorts of things. It's a mindset that if you want to develop a nice village community setting, then you do need to go down to 30 kilometers per hour all through the village and that sort of thing. So, and that might be one of the appeals to other countries as well.
Yeah, thank you. So we've only got a couple of minutes left. We might just finish off with reflections from each of you. We'll start with Masria. With looking at the difference between this action plan and the one from the last decade, if there's one thing that we do differently that will make a difference, what would it be?
I think we would definitely like to treat the road safety issues like how we treat the COVID-19 pandemic. So that's something that I would really want it to be. And road safety is about localizing. It's about high level of ownership and awareness of all those sort of barriers and knowledge of the measures need to be in line with appropriate steps that has to be taken to maximize the likelihood of everyone participation. So that's something from me.
Thanks, Masria. Martin, 20 words or less.
There's a question here from Ganeet about learnings from India. there are impressive people engaging in this problem all around the world, like deeply impressive people. And I think that personal and professional capacity building is really, really important over these next few years. This decade is important, but actually a real ongoing commitment to the professional strength and the community strength and the NGOs that Laurie talked about. I think that's really important.
Laurie, quickly.
Yes, I think the international outreach approach that the college has taken is a very nice model. And what I'd like to see happen over this coming decade is much more international networking to mutually understand each other's challenges and support people on the basis of that understanding.
Great, thanks everyone. And thanks so much to everyone who's joined us for this webinar today. If you are not a member of the College of Road Safety and you like what you've heard and you'd like to be more involved, then please head to our website and there are details there about how you can join. Thank you to everyone, stay safe and more action on this global decade to come. Thanks everyone.